If someone has told you spine surgery and you are wondering whether that's safe or dangerous, and you might have had people who have told you that spine surgery is very dangerous, you shouldn't have spine surgery, you'll be bedridden after surgery. Are they really right? I don't blame them, to be honest. But are they really correct? Let's understand that in detail in this video. Welcome to my channel Zen Spine English. My name is Dr. Rakesh Dhake. I'm a spine surgeon working in Mumbai. Now, whether spine surgery is safe or dangerous, we'll consider this topic point-wise in sections, of which I would like to first bring to your notice, when should you go for spine surgery? Now see, spine is a very delicate part of your body for which we would do surgery only when all the other measures or conservative measures, injections, pain management have failed, and despite of that you continue to have your symptoms. That is when we go ahead with surgery. Now, if surgery is done, usually most of the patients come with back pain and they have leg pain going down their legs, claudication, meaning they have to sit after walking for some time. And in such patients, in lumbar spine, below L1 level, there is no spinal cord. There is just your nerve roots, what we call is cauda equina. So the chances of injury or accident to the spinal cord are very less or null, and hence because of that, paralysis due to lumbar spine surgery is almost theoretically not possible. But if things go wrong or if some accident happens during that surgery, the chances of which are very, very rare, in that case, the patient might lose power in a particular part of the leg, like their ankle or their feet, their big toe. Also, there might be problem in the private parts, but to have a pure paralysis like below the waist, it is difficult with lumbar spine surgery. Now, if surgery happens above L1, which is your thoracic or the cervical spine region, then yes, spinal cord is present there. But with all the advanced techniques like microscope and minimally invasive surgery, we have good illumination, we have good vision, and with all these advanced technique, the chances of damaging the cervical spine or thoracic cord are very, very less. Plus, we have what we call neuromonitoring, which we use in cases like very severely compressed thoracic spinal cord or even cervical spinal cord, which tells us during the surgery that if the signals are correct and if the power or if the cord is still functioning correct, or if there is any insult to the spinal cord during the surgery, then we might stop the surgery or reverse what we've done. So with all these advanced techniques, the chances of damaging the spinal cord are very, very rare, and hence chances of paralysis are quite rare. But consider a situation where a patient comes to us at a very late stage when their spinal cord is severely compressed already for many, many months or many, many years. The patient has been having imbalance. They're not able to walk properly. They're not able to hold properly. They've been having this problem for few months. They've been going to the doctor. They're giving them medicines, and doctor has told surgery, but they are afraid. They don't want to get operated. And they come to us when they actually lose power in their legs, or they come when the things are so bad that to revive the cervical spinal cord or to revive the spinal cord, it's very difficult. So in such cases, sometimes due to compression of the spinal cord, the color of the spinal cord might also change. What we call is myelopathy, meaning the spinal cord has turned its color to white in the MRI scan. To explain this in simple language, if you tie a rubber band around your finger and you remove that after some time, you can see the color of the finger under the rubber band is different than the rest of the finger. Similarly, if the spinal cord is compressed for quite some time, and if you remove the compression even after that, the discoloration might still be there, and that does not heal completely, what we call myelopathy. If patient comes to us at this stage, then during surgery, even a minor of our insult or even a minor hit with an instrument, which we may not even realize during the surgery, can injure the spinal cord, and that may lead to the paralysis. So, did the surgery went wrong, or was it doctor's fault? Very likely not. You have come to the doctor at a stage where the spinal cord has been so badly compressed that chances of it having injury during the surgery has increased. Sometimes even the sudden blood flow, what we call reperfusion injury, can also lead to paralysis. Now, chances of this is very, very rare, but yes, it can happen. The other misconception that people have is after spine surgery, you will have a very prolonged bed rest. You will be on bed for months and months. Now, usually that's not the case. With advanced techniques and minimally invasive spine surgery, our patients usually are able to walk in a day or two after the surgery on their own or with support, and the pain down their legs is improved to quite some extent. Now again, I'll go back to the situation where the patient presented very late and the cervical cord was compressed or the thoracic cord was compressed for many, many months, this patient, mind you, is not going to immediately improve. This patient may take few weeks or months or even years to improve. So it is not that the surgery has failed, that the patient has presented so late that the outcomes are not going to be very promising immediately after the surgery. So why was the surgery done in this case? That is the discussion for you to have with your doctor before the surgery, because the surgery is done so that you don't get further progression or you don't worsen anymore. And hence, to stop this progression, that is why surgery was done. So in general, if you do surgery for the right indication, you have understood why you're doing surgery, and you weigh the risks and benefits, and if you feel the benefits are more after the surgery, and you're doing it from a sensible doctor, spine surgeon whom you can trust, you have that confidence in him, talking to him, you feel that this is the right doctor for you, and he has explained you well, he has answered your questions well, and you had a good understanding of what the problem is and what the solution is. And if you do this surgery in a good setup or a reasonable setup, then yes, usually the success rate of surgery is good. But as few situations I told you, in these situations, the results may not be as good as otherwise, but it is very important that you have realistic expectations from the surgery and you discuss this with your doctor. Having understood this, I can definitely say that having spine surgery is safe when done for the right indication and under the right circumstances. I hope this video has given you some good information that has helped you. And if it has, then please do not forget to like and subscribe this channel. It helps us reach more people and spread spinal awareness. If you have any doubts, you can definitely write in the comment section below, and we'll try our best to reply you as we get time. Thank you so much.